3 people are dead and at least 3 others are sick after a suspected outbreak of what's called henta virus aboard a cruise ship. Now, the vessel is currently anchored off the coast of Africa with nearly 150 people on board while health officials try to figure out next steps. Here's CNN's Larry Madowo.
A suspected outbreak of henta virus on board this cruise ship crossing the Atlantic Ocean. The MV Hondius, operated by Oceanwide Expeditions, departed Ushuaia on the southern tip of Argentina over a month ago. Details of the suspected outbreak emerged as it was anchored in Praia, the capital of Cape Verde, an island nation off the coast of West Africa, on Sunday. One American travel blogger on board issuing this tearful message.
We're not just a story. We're not just headlines. We're people. People with families, with lives, with people waiting for us at home. There's a lot of uncertainty, and that's the hardest part. All we want right now is to feel safe, to have clarity, and to get home.
Cape Verdean authorities have refused to allow anyone to disembark. However, local health authorities visited the ship and assessed 2 symptomatic crew members requiring urgent medical care, Oceanwide Expeditions said in a statement. There are 17 Americans among the 149 people on board, according to Oceanwide. The company told CNN it is, quote, currently focused on the health and safety of passengers and crew. Humans most commonly get infected with hantavirus through contact with rodents like mice or rats, especially their urine, droppings, and saliva, according to the Centers for Disease Control and Prevention, CDC. Early symptoms include fatigue, fever, and muscle aches, as well as headaches, dizziness, chills, and abdominal problems. Human-to-human transmission is rare, the World Health Organization says.
To have this many people clustered together on a ship, most public health officials would be looking for human-to-human transmission, and I'm sure this is going to be investigated tremendously, but that would be where the arrows are pointing right now.
So far, it's not clear how the suspected infections on the ship occurred. The first death on board this ship happened April 11. The body of a 70-year-old Dutch man was taken to the island of St. Helena, a remote island in the South Atlantic, according to South Africa's Department of Health. His wife later collapsed at an airport while trying to fly home and died in hospital. At this time, it is not confirmed that these 2 deaths are connected to the current medical situation on board, the operator said. The World Health Organization says it is facilitating between member states and the ship's operators on a full public health risk assessment, but added, quote, the risks to the wider public remains low. There is no need for panic or travel restrictions. Larry Madowo, CNN.
Thanks to Larry Madowo for that report. Joining us now to discuss